In terms of the correct method of breast self-examination, in terms of just being aware of what's going on with your breasts and knowing your breasts, how to check and what to do?
So it's supposed to be done at least once a month. So recommendations usually about a week after your period. So during your period, because the breasts get a little bit tender, might be a little bit painful, so you might not do a very thorough examination, because we want you to do a superficial sort of light touch and then sometimes do a deeper touch. So one week after your period, you can do it standing or lying down, or both. So when you're standing, can be in the shower. That's what most ladies commonly do, so that at least with the soap, it's easier to just check all areas. And you can also do it lying down. So what we recommend is that when you're examining, let's say the left side, you use your right hand. So you put your left hand, if you're standing, the left hand goes up. If you're lying down, it goes behind the head. And then you use your fingers. So usually these three, so these three, and then you don't poke, you don't pinch, you just use the flat. And then you be systematic. So if you're going to start at the top, so there are different techniques. You can start at the top and go round. So you need to be very systematic. So if you're going to go round, you can go clockwise. So you touch, you do a palpation. So you're going all the way around.
So you're pressing.
You're pressing, you go all the way around. So when you're doing this, it's to try and feel whether there's anything abnormal, any lumps, anything unusual. And then you squeeze the nipple areola region gently, just to see if there's any nipple discharge. That's also something that we need to look out for when you're trying to look out for any warning signs of breast cancer or breast disease. And the one that would be most alarming if it's a bloody nipple discharge. And then that's for the palpation. So there's that method of going circular, can be clockwise or anti-clockwise. Sometimes you can go radial from outside coming in towards the nipple. Some people also talk about an up and down. So you start, let's say, if this is the left, so this would be the side of the sternum. So you can go up and down. So the whole point is...
You're looking for any lump.
Any lump. But the whole point is just to be systematic, make sure you don't miss out on any quadrant of the breast. And you need to squeeze to see if there's any abnormal discharge. You also need to stand in front of a mirror without your shirt or your bra, just to check for symmetry, because sometimes that's another thing that might alert you to something going on. Because breasts are usually slightly asymmetrical. But now if it's a recent onset of significant asymmetry, if you stand in front of the mirror, you can see.
Like one is bigger, one is significantly bigger. Sometimes it can get shrunken because the tumor can shrink and then it's fixed to the chest wall. So any significant asymmetry.